My name is Christine Lemke. I'm the co-founder of a company called the Activity Exchange. The Activity Exchange measures the outcomes for all sorts of digital behavior interventions in healthcare, measures them, and then figures out the right intervention for the right people. So a diabetes type 2 person goes home without a lot of education or information, and we step in and we deliver those education nuggets or recommend apps to use to manage their disease on an ongoing basis. Our customers are typically large pharma companies or large health insurance companies. And an example would be a large insurance company wants to allow their members to connect things like Fitbits, to connect things like sleep apps, to connect diagnostic tools, at-home diagnostic tools, etc. And they want to make sure that these activities map to some sort of health outcome so that they can figure out how to discount premiums, for instance, or they can figure out which programs are working for which people and target those interventions in a meaningful way. It's been exciting and fun to see things like Fitbit wearables and step-connected pedometers really take off. Like, it's been incredibly fun to see that. We see that on our platform. We see that with our own clients. So that's been great to see. Where I think the most meaningful interventions are going to come from, though, are from things that take a slightly clinical bend to their solutions, that have run studies that can prove that their particular solution really improves, the A1C level of a diabetic, for instance, or really improves compliance or adherence. Those are the things that are going to move the needle in healthcare. It's great to see all this other stuff, but they, at some point, have to connect together. The Affordable Care Act definitely opened up a lot of opportunity in the area, but one thing that we've noticed is you have to learn how to speak the language. And nobody says you have to go out and memorize all 955 pages of the Affordable Care Act, but you at least need to learn how to speak their language and understand who's paying for everything at the end of the day, and how to craft solutions that there's a reimbursement model for them instead of just crafting solutions and hoping that consumers will adopt them, which is the mentality, truthfully, that a lot of Silicon Valley companies pursue, but doesn't work in healthcare. Consumerization, people need to like what they're using as far as digital interventions are concerned and behavior change is concerned. But if those interventions aren't effective and aren't driving some sort of ROI for the healthcare industry, they're not going to get adopted, because over and over and over again, we see that consumers aren't actually willing to pay for those things. So somebody has to pay for them, and that's the key difference. Selling into this industry is just like selling into any other industry. You have to establish trust, you have to build relationships, and you have to speak their language. And entrepreneurs who overlook that, I think, are going to have a hard time scaling their businesses and creating business models in healthcare.